1. A patient care technician PCT is teaching a new hire proper patient transfer techniques. What is the most effective instructional strategy using adult learning principles? A. Use written instructions and require memorization. B. Demonstrate the transfer, then allow practice with feedback. C. Conduct a quiz before allowing any patient interaction. D. Require the new hire to watch a recorded video without interaction. 2. During a safety training session, a PCT mentor uses case scenarios to review infection control protocols. What instructional method is being used? A. Rote memorization. B. Drill and practice. C. Problem-based learning. D. Auditory repetition. 3. Which method best evaluates a PCT's understanding of patient fall prevention protocols? A. Open book written exam. B. Peer-reviewed research project. C. Observational checklist during simulation. D. Online multiple choice test. 4. A new PCT asks why sterile techniques are essential during catheter insertion. What is the best mentoring response? A. That's just the policy. B. You'll understand as you get more experience. C. Let's review the infection risks and best practices together. D. Do what the nurse tells you. 5. Which of the following best aligns with curriculum development for training PCTs in emergency response? A. Including CPR certification as an elective. B. Incorporating step-by-step videos only. C. Using lectures exclusively. D. Integrating simulations and performance evaluations. 6. When mentoring a struggling PCT trainee, what approach encourages professional growth? A. Assigning extra night shifts. B. Publicly correcting mistakes. C. Scheduling one-on-one skill reinforcement sessions. D. Ignoring minor errors to avoid discouragement. 7. What communication strategy is most effective when explaining discharge instructions to an elderly patient with hearing loss? A. Speak rapidly and loudly. B. Use written instructions only. C. Use visual aids and speak clearly at eye level. D. Delegate to another staff member. 8. Regulatory compliance in patient safety requires PCTs to report. A. Only confirmed errors. B. Suspected safety concerns and incidents. C. Incidents that cause visible harm only. D. Issues that patients report directly. 9. A clinical instructor evaluates a PCT's bed bath technique. Which method best assesses both knowledge and skill? A. Oral presentation. B. Demonstration with real-time feedback. C. Group discussion. D. Multiple choice test. 10. In adult learning, what factor best supports retention of new safety protocols? A. Passive observation. B. Repetitive written drills. C. Hands-on practice in realistic settings. D. Frequent pop quizzes. 11. What should a mentor prioritize when coaching a PCT on difficult patient interactions? A. Emotional detachment from patients. B. Scripted responses for all situations. C. Development of empathy and de-escalation techniques. D. Avoiding all confrontational patients. 12. a hospital requires PCTs to review new fall prevention guidelines. What curriculum tool is most appropriate? A. PowerPoint slides only. B. Daily verbal reminders. C. Competency-based learning modules. D. One-time email announcement. 13. Which approach best assesses a PCT's clinical judgment in infection control? A. Pre-test and post-test comparison. B. Real-time simulation with scenario analysis. C. Group brainstorming sessions. D. Weekly written logs. 14. When correcting a safety error by a PCT, how should the feedback be delivered? A. Immediately and privately, with constructive direction. B. In front of peers to prevent repetition. C. Via written reprimand only. D. Through indirect suggestions over time. 15. A PCT mentor observes a trainee struggling with time management. What is the best approach? A. Assign more patients to increase efficiency. B. Encourage multitasking regardless of policy. C. Offer training on prioritization and scheduling. D. Ask the nurse to handle their duties. 16. What is the most reliable method to ensure ongoing patient care safety training among PCTs? A. Annual policy handout. B. One-time lecture during orientation. C. Mandatory quarterly competency checks. D. Self-study options. 17. A PCT is unsure about the sterile field boundary. What regulatory protocol should be followed? A. Continue the procedure unless contamination is confirmed. B. Stop and ask a nurse immediately. C. Restart the setup to ensure sterility. D. Ignore unless a supervisor notices. 18. Which learning technique reinforces adult learners' understanding of safety procedures? A. Abstract theory lectures. B. Peer-reviewed article readings. C. Active simulation and peer critique. D. Pre-recorded training with no assessment. 19. A PCT fails to identify a choking risk during meals. What evaluation method best addresses this safety gap? A. End-of-shift written report. B. Simulation-based retraining with observation. C. Peer counseling. D. Electronic feedback survey. 20. What is the best instructional method to teach hand hygiene to visual learners? A. Lecture with statistics. B. Role play only. C. Step-by-step demonstration and posters. D. Reading WHO guidelines. 21. What is the priority when training PCTs in postoperative care safety? A. Encouraging independence immediately. B. Strict bed rest regardless of condition. C. Preventing complications through proper monitoring. D. Limiting mobility aids. 22. How should a clinical instructor assess the ethical decision-making skills of a PCT in patient care? A. Multiple choice quizzes. B. Role-play ethical scenarios. C. Peer feedback only. D. Video lectures. 23. What instructional strategy enhances PCT retention of fire safety protocols? A. Annual in-person lecture. B. Realistic drills with evaluation. C. Reading emergency plans only. D. Watching a 10-minute video. 24. What method helps adult learners transfer safety training into clinical practice? A. Frequent abstract assessments. B. Observation of experienced staff only. C. Practice with feedback and debriefing. D. Memorizing written policies. 25. When communicating with patients with limited English proficiency, PCTs should: A. Speak louder to aid understanding. B. Use medical jargon slowly. C. Use certified medical interpreters. D. Ask a family member to interpret. 26. A PCT fails to log patient vital signs. What regulatory consequence might occur? A. Verbal warning only. B. Risk to patient safety and institutional liability. C. Only nurse is liable. D. No impact if the patient is stable. 27. What is the best way to teach proper use of PPE to newly hired PCTs? A. Reading OSHA documentation. B. Watching a video independently. C. Live demonstration followed by individual return demonstration. D. Quizzing before explanation. 28. Which of the following methods is most effective for reinforcing infection control practices? A. Monthly written memos. B. Surprise inspection without feedback. C. Routine performance observation with coaching. D. Annual skills checklist. 29. A mentor evaluates a trainee's ability to perform CPR. Which approach is best? A. Written multiple choice test. B. Partner discussion of protocols. C. Realistic scenario with feedback and certification. D. Self-assessment only. 30. Which regulatory body sets standards for patient safety practices in hospitals? A. CDC. B. OSHA. C. Joint Commission. D. FDA. 31. What tool best evaluates the competency of a PCT in safe patient ambulation? A. Video reflection essay. B. Live demonstration with scoring rubric. C. Written test. D. Peer feedback form. 32. A patient complains of dizziness during ambulation. What should a trained PCT do first? A. Ignore it if vitals are stable. B. Assist patient to sit and notify nurse. C. Ask another patient to assist. D. Continue slowly. 33. When developing training curriculum for fall prevention, which component is essential? A. Posters in staff lounge. B. Interactive case-based learning. C. Verbal reminders at meetings. D. Weekly emails. 34. Which communication approach ensures patient understanding of post-discharge care? A. Providing a link to online resources. B. Using plain language and teach-back method. C. Relying on discharge summary. D. Asking family to explain later. 35. What method provides the most effective feedback during clinical instruction? A. Annual reviews. B. Peer evaluations. C. Immediate, specific, and actionable feedback. D. Open suggestion boxes. 36. What instructional method suits kinesthetic learners in patient safety training? A. Case reading. B. Group discussion. C. Hands-on simulation. D. Watching a webinar. 37. A trainee repeatedly uses improper transfer technique. What mentoring strategy is appropriate? A. Terminate training immediately. B. Assign another task permanently. C. Offer targeted retraining and supervision. D. Ignore unless injury occurs. 38. What is the primary goal of safety huddles in patient care settings? A. Social interaction. B. Policy review. C. Real-time safety communication. D. Performance ranking. 39. Which regulatory guideline governs patient confidentiality in care? A. HIPAA. B. FDA. C. OSHA. D. Joint Commission. 40. What evaluation technique is most useful in real-time clinical training? A. Essay exam. B. Direct observation and feedback. C. Group presentation. D. End-of-day debriefs. 41. Which method best develops critical thinking in emergency response scenarios? A. Reading emergency protocol books. B. Discussion groups. C. Simulation-based scenario training. D. Online quizzes. 42. How should a mentor help a trainee recognize early signs of infection in patients? A. Assign textbook chapters. B. Demonstrate and discuss during rounds. C. Require weekly essays. D. Recommend a YouTube video. 43. A PCT reports a sharp container overfilled. What is the proper action? A. Ignore if it's not leaking. B. Remove and dispose of sharps by hand. C. Report to supervisor immediately. D. Label the container and leave in place. PCT Patient Care and Safety Test. The PCT Patient Care and Safety Test is a comprehensive assessment designed to evaluate the knowledge, skills, and professional judgment of patient care technicians PCTs in delivering high-quality, safe, and compassionate care. This test focuses on core areas such as patient hygiene, mobility assistance, infection control, vital signs monitoring, and emergency response procedures. It also emphasizes regulatory compliance, communication, ethical standards, and collaborative care in clinical environments. Candidates are tested on their ability to follow safety protocols, respond to critical situations, and apply adult learning principles in real-time patient care. The exam ensures that PCTs are prepared to support nursing teams and provide safe, evidence-based care to diverse patient populations. Here are the top 5 beneficial uses of the sample exam. 1. Ensures competency in clinical skills. The test validates that patient care technicians possess essential hands-on skills such as infection control, vital signs monitoring, and patient mobility assistance, ensuring safety and quality care. 2. Promotes regulatory compliance and patient safety. It reinforces adherence to safety standards and legal guidelines, reducing the risk of medical errors and enhancing accountability. 3. Strengthens communication and teamwork. The exam assesses a PCT's ability to communicate effectively with patients and healthcare teams, fostering collaboration and trust in fast-paced clinical environments. 4. Supports professional development. The test helps identify areas for growth, enabling targeted training and continuing education for long-term career advancement. 5. Improves patient outcomes. By ensuring PCTs are well prepared, the exam contributes to better patient care experiences, reduced hospital stays, and enhanced recovery processes.